In this video, we'll explain what post-thrombotic syndrome is, why it happens after a blood clot, and how you can spot the signs early to protect your health. Let's get started.
Hello everyone, welcome back to Thrombowatch. This is Dr. Aman Sharma. I'm an internal medicine doctor and also co-founder at Thrombowatch, where we try to simplify the blood clot related problems and prevention techniques. So in this episode, I'll be talking about post-thrombotic syndrome. Many of you, as our viewers, have asked that you have pains after you have some clot in the legs. This could be post-thrombotic syndrome. So what I'll try to do is very briefly and in very simple way, try to explain to you how life can be after you have blood clots in the legs or even in your lungs. And this would basically serve as a guide for you all about preventative health. This is not video about any of the treatment or advice as such. It is just for prevention and making life better because knowledge is prevention. So we'll talk more about in the coming slides. So if I were to ask you, what is post-thrombotic syndrome? Must have heard about people having clot in their legs and that after the clots have gone, we've treated the clots, they might still have some pain in the legs. So this is basically a complication, a sequel, you may say, of someone who's got deep vein thrombosis, which affects the blood flow and the veins in your legs. So if this condition develops, it is basically because the blood vessels in which you had the clot formation have sustained some damage. The valves have been become a bit more leaky or they are not that strong. And because of this, there is a normal disruption in the normal blood flow, also causing pooling of the blood in your legs. And all of these in a cumulative effect will cause some pain, discomfort, swelling, some skin changes, which we call as chronic venous changes or hyperpigmentation. Few people can also have swelling in their legs, and few people, because of this insufficiency of the blood there, you can also have ulcers, and these are basically very difficult to treat and they can be very long term. And to just to make a better more understanding, quite a few percentage of people who had clot in their legs, the DVT, do suffer from post-thrombotic syndrome. So let's talk a bit more. What causes this complication or this sort of follow-up condition after one had clot in their legs? So number one is the damage to the blood vessels. Of course, when you had a clot deposition in the blood vessel, in the veins, it would have caused some form of vascular damage, the damage to the valves, because when we talk about the veins, they also contain small valves. So, the blood doesn't go back completely down. So the blood is pushed against the gravity towards the heart from especially the leg veins. And there are valves which try to help the blood flow back to the heart. So these would have got damaged because of the clots that were formed. So now a cumulative effect is if the valves are not working well, you might have pooling of the blood, which might be looking, if you look at your legs, they look congested, they look a bit more swollen, there's a bit of a discoloration, and this basically also causes then the symptoms to come because now you've got the discomfort, your normal leg was having a different vasculature, a different sort of blood vessels. Now they've changed. And since with the change of this normal physiological blood vessels, you will also have few sort of symptoms. What could basically increase one's chances to develop this sort of complication? If the person had very large blood clots in the legs, usually when we talk about the calf veins, the pumping, what to say, muscles in the legs and the back of your legs, if there's a small blood clot, things might be different. But if the blood clot ranges from tip to toe, like even the complete leg, this can basically hamper a big area of the blood vessel and cause massive symptoms. If the clots are usually located above the knee, so anything which goes away from the body, we call it as distal. Anything which is near the body, we call it proximal. So here, if someone's got clots above the knees in your popliteal veins, in your femoral veins, these usually would have more damage to the blood vessels. And of course, delay in initial investigation and treatment of someone with the deep vein thrombosis would also cause more side effects, more sort of complications with the blood vessels. Thereby, the sequel would be you have discomfort, you have pain, you have swelling, you have pooling of blood. What I would have loved for people to understand better was if you could recognize the symptoms well in time. Again, because if someone had a blood clot and after their blood clot has been treated and then they are presenting with again swelling of leg, pooling of blood, discoloration in the legs, some sort of discomfort, tingling, numbness sort of sensation, these all basically are the red flags for you to understand that something might not be right. Of course, pain and discomfort are the most common symptoms in these cases. If you walk, if you've been standing for some time, you might feel a persistent sort of heavy, dull, dragging pain there. You might also observe that there must be some swelling. So usually when you sat for long and you can see, oh, my leg looks a bit swollen, and if you press on the leg, there might be a small dent in your skin. And this basically says that, oh, you've got some edema or deposition of fluids, as we usually talk. But this can basically improve if you improvise with the positioning and movement of your legs. Skin changes again because the veins take away the deoxygenated blood back to the heart. So now you've got pooling of the blood, thereby, the skin would also be affected. You might see in comparison that your skin looks a bit more darker, a bit more drier, brownish. It looks a bit more thick. And if you look around your ankles, there might be breaking of the skin and basically some cracking in the skin, thereby causing a sort of wound, which we call as ulcers. Also, if you see your leg might be looking congested, the veins in your legs might be looking a bit more tortuous, a bit more or prominent, as you may say. Usually you won't see them that well, but it looks very prominent. And basically, as I said, if this insufficiency increases and increases, you might have a condition where there's a sort of blistering or the skin is getting broken and then it's not getting healed, which causes venous ulcers, which can be further infective. They can ooze some fluid because of the swelling and the congestion. They might be painful, they might be cosmetically not that great that you would love to see in your legs. So many things can actually happen. And if you're recognizing any of these symptoms after you had a blood clot, it is very vital to go and discuss this. So for us as clinicians, how do we diagnose someone as to have PTS? So first of all, medical history is the key here. If we know that you had blood clots in the past or you currently have the symptoms of blood clots, previous history of family history of blood clots, this basically gives us a way to think, oh, whether this could be blood clot related complication. Clinical examination, of course, we don't use any such obvious scores. I've just written for you to understand it. But main thing for us in the examination is if your leg is swollen more in comparison to your other leg, if your leg seems congested, discolored, if there is pain, there's discomfort, there's tenderness when we are trying to examine, palpate, these are all the basic flags that we would be thinking about. And of course, if we are suspecting someone to have clot in their legs, the deep vein thrombosis, we would usually send them for an ultrasound Doppler scan, which basically tells us if there is a clot or there is none. However, if you had previous blood clots and you've got persistent pain, swelling, and the other symptoms that I talked, think about whether this could be post-thrombotic syndrome. So what could be the treatment options? I've given you the problem. What could be the treatment solutions? So number one is the compression therapy. You might all would have seen the compression stockings, the TET stockings that we usually prescribe to people. So what it basically does is it causes a sort of pressure in your legs, thereby doesn't allow or facilitates the blood return to the heart, and thereby, what to say, you may say there is less congestion of the blood vessels, less pooling of the blood, and thereby it helps for us to avoid these sort of complications. Exercise and physiotherapy. Again, like any sort of trauma, any sort of injury, if your blood vessels have suffered an injury, they also need to have sort of rehabilitation. The way we do it is if you could strengthen the muscles, because as we said, your heart is a muscle, it's a pumping organ, it's a muscle, where your calf muscles also act as pumping organs because if you've got good calf muscles, good strength in your calf muscles, it improves the venous return, it improves the blood return to the heart, and thereby minimizing these complications. Of course, if people are in pain, we do prescribe some painkillers. If people have higher risk of developing blood clots or had very extensive sort of blood clots, we might continue to keep you on the blood thinning medications, the anticoagulants, which can be warfarin, rivaroxaban, apixaban, or even enoxaparin injections, depending. What the basic you could also do is make sure your skin is a bit healthy. So make sure that applying creams if there's a dryness, you're applying dressings if you've got ulcers and getting it seen. So most of these cases would be treated conservatively. We do not usually consider an operative intervention because the overall prognosis or overall good results are not that great with these sort of interventions. So predominantly compression and physiotherapy are mainstay. For the symptoms, we can get you some pills and medications. How is life living with these sort of conditions? Unfortunately, we do not live in a world where everything is black and white. We have few areas where you're not very sure what to do. But again, lifestyle modifications can play a very important role for you to cope up, just not in the recovery, but also provides your overall outcome in the longer run. Regular activity, we always say this, walking and low impact in exercises do improve the circulation. So form your groups, make friends, go out on walks wherever you can. I'm not saying you have to do a 10-mile hike. Whatever you do does help. So try to keep your pace a bit brisk on a bit of a higher end and try to go out and walk as much as you can. Leg elevation, very simple thing. Most of us would be watching TV, our legs are down. If we're sitting prolonged hours, our legs are down. If you could kindly elevate your legs a bit, that gives a lot of relief to the blood vessels, to the calf muscles, and this basically can improvise your overall symptomatic journey with these sort of conditions. Weight management, of course. See, if you've reduced your weight again, in our body, when we become big in terms of we gain weight, it's not the muscles that are gaining the puffiness. It's basically the fat tissue, it's the adipose tissue. So we might be looking at my leg is this big, so I should have this big muscles. No, but if you're obese, it would be very difficult to say how much is actually the muscle and how much is the fat. The fat would be there. So weight management in terms of modifying your diet, trying to be stable with the number of calories you're taking, the amount of sugars that you're taking will help you definitely. But I would not recommend you guys to jump on the ship where you can have the injectable medications to reduce your body weight and not actually do physical exercise. Not recommended at all, guys. We're seeing loads and loads of studies coming out. People have lost weight, that's brilliant, but it's not something that should be first line. Unfortunately, we're missing the first line and jumping to the last resort of losing weight. Skincare, of course, if you've got dry skin, if you've got cracks, if you've got unhealthy sort of looking skin, make sure you apply creams and moisturizers, make sure you get them dressed well. These are the small things that you could do. And if you develop a consistent routine with all of these, the life might be a bit different and your management with post-thrombotic syndrome might look a lot easy than what it might be looking now. Finding support, very vital. Unfortunately, we live in a world where we share that, oh, you've got this, you are being judged, but finding the right support is equally important because it just not helps you cope emotionally. It also gives you another reason so that you can push and exceed your limits and try to get back to your normal baseline. So if you think, oh, why did I have a blood clot? I've always told this before as well. Unfortunately, we also carry some genetic influence, which can cause the blood clots to become a little more easier than the other people. And in the past, as I've told you, athletes also have got these problems. Serena Williams had a pulmonary embolism, but she was absolutely fit and healthy. But things can happen. It's just not you. It can happen to anyone. But our job is to make sure if we see the symptoms, as when you go onto the trains here, they say, see it, say it, sort it. I would say, if you see that you've got the symptoms, please go and talk to your clinicians and make sure there's plenty of things that can be done to sort these sort of suffering. When to seek medical help? Again, very important. If you've got new or sudden worsening of your symptoms, if there's new increase of swelling in your calves, there's discoloration, skin hardness, ulcers are coming up, these are definitely something that you need to be escalating. Of course, if the swelling is new, that could be a new DVT because unfortunately, people who had DVT once can develop it in the future as well. In terms of you getting a medical help, also it's very important that early intervention can all help us to prevent the complications and improve the outcomes. So if you've got swelling in your legs, pain in your legs, shortness of breath, discoloration in your legs. These are all the signs you may see that someone might be having a clot in their legs. And that is where your job is to make sure you've noticed the symptoms, you know the symptoms, because as we said, knowledge is very important here. If you've got these symptoms, go to the hospital, get it seen, and get yourself treated. So I hope this helped you understand a bit more about post-thrombotic syndrome. If you've got any of these symptoms, please report it to your clinician. We'll try to post more such informative content on Thrombowatch. And if you've got any topics that you would like to talk about or hear about, do engage with us, do leave your comments. And equally, if you've suffered any of these medical conditions and you want to come out to the world and tell your story so that others don't have it, we are more than happy to host you on our podcast. So I think that would be all from my end, guys. And I wish you remain healthy. And if you've got these symptoms, don't take them lightly. Just go to the hospital, get it seen, stay safe. Thank you so much.
This podcast is for informational purposes only and does not constitute medical, legal, or financial advice. The views expressed are the personal opinions of the Thrombowatch team. If you think you may have developed a blood clot, please speak to your healthcare provider urgently. Health-related information shared in this podcast, including text, graphics, images, and other material, is intended for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your doctor or another qualified healthcare provider with any questions you may have regarding a medical condition. If you believe you're experiencing a medical emergency, call 999 in the UK. For less urgent support, call 111. Thank you.